Good afternoon and welcome to today's Public Health Ontario Rounds presentation on alcohol risk and policy, Canadian Alcohol Policy Evaluation, also known as CAPE 3.0, the Ontario results. This is part 2 of a 5-part series focused on alcohol-related risks and policy. My name is Dr. Erin Hoban, and I am a scientist at Public Health, a senior scientist at Public Health Ontario, and I have the pleasure of moderating today's session. To start today's session, I wish to acknowledge the land on which Public Health Ontario operates. It has been the traditional land of many distinct nations, including the Huron-Wendat, Seneca, Métis, Haudenosaunee, and Anishinaabe, specifically recognizing Treaty 13 signed with the Mississaugas of the Credit First Nation. I am grateful to have the privilege to work on this land. Before introducing the presenters, I will mention a few housekeeping items. The chat pod has been disabled to limit any distractions during the presentation. Please use the Q&A pod if you have questions during the session, and we strongly encourage questions, so please do put them in the Q&A pod. A discussion and question period will follow the presentation. If at any point during the session you experience any technical issues, please email capacitybuilding@oahpp.ca. I would like to state that as the moderator of this session, I do not have any conflicts of interest to disclose. It is now my pleasure to introduce the speakers for today's presentation. First is Bella Priore, next, Dr. Tim Stockwell, and finally, Dr. Mark Asbridge. Bella Priore is a researcher with the Canadian Institute for Substance Use Research, also referred to as CSIR. She was heavily involved in the data collection and stakeholder engagement for the CAPE project. She has also been involved with various internal and collaborative projects at CSIR surrounding the topic of drug and alcohol policy in Canada. She graduated with her Bachelor of Science in Psychology with honors from the University of Victoria in 2022 and completed her thesis on university students' perception of alcohol warning labels. Next is Dr. Tim Stockwell. He was the director of the Canadian Institute for Substance Use Research, or CSIR, which was formerly the Centre for Addictions Research of BC. And he was the director from its inception in 2004 until 2020. He led Australia's National Drug Research Institute as deputy director, then director for 16 years. Tim's research interests in alcohol policy include measurement and modeling of alcohol consumption and related harms, and assessing impacts of pricing and taxation policies such as minimum prices. Tim is a fellow of the Royal Society of Canada and received the 2013 E.M. Jelinek Memorial Award for outstanding research on social, cultural, and policy aspects of alcohol, with special mention of his work on minimum alcohol pricing. And finally, Dr. Mark Asbridge is a professor with the Department of Community Health and Epidemiology at Dalhousie University in Nova Scotia. Mark has been a co-investigator with the CAPE project on all 3 iterations to date. Mark's areas of expertise include impaired driving countermeasures, minimum legal drinking age, alcohol, and youth. So now, Bella, I'd like to pass it over to you to start the presentation, please.
Thanks, Erin, and hello, everyone, and welcome to our presentation on the Ontario-specific results from the CAPE 3.0 project. My name is Bella. Just to disclaim that this presentation was created by the CAPE team, and although it will be published on the PHO website, PHO is not the owner of the content. Any application or use of the information in this document is the responsibility of the CAPE team, and the PHO assumes no liability in resulting from any such application or use. So we would like to thank our funders and supporters, but please note that the views and opinions expressed as part of this presentation are those of the CAPE project team and do not necessarily represent those of our funders or other organizations acknowledged. This presentation will provide a brief overview of the CAPE project and policy domains and present results and recommendations specific to Ontario to improve alcohol policy and thus reduce harms. And we'll go into specific results for the following domains: pricing and taxation, physical availability, minimum legal age, and screening and treatment interventions. By the end of this event, participants will be able to describe Ontario's alcohol consumption costs and harms, identify key alcohol policy domains proven to reduce harm from alcohol use, describe best practice policies within the domains we're covering, and identify areas of strength and opportunities for improving Ontario's alcohol policies. So what does CAPE offer? CAPE provides a rigorous assessment of how well each level of government in Canada is implementing policies proven to reduce harms from alcohol use. This is the third time the assessment has been performed and includes all provinces and territories as well as the federal level. So CAPE offers accessible, evidence-based, up-to-date information for policymakers, researchers, NGOs, amongst others, systematic policy comparisons between Canadian jurisdictions and over time, a platform for informing the public about effective alcohol policies, a mechanism for keeping a public health approach to alcohol policy on government agendas, and a community of practice with more than 450 members facilitating learning events and knowledge exchange. So why does CAPE matter? This slide is just kind of taking a look at alcohol consumption harms and costs, specifically in Ontario in the year 2020. When looking at alcohol consumption, people in Ontario consumed the equivalent of 457 standard drinks of alcohol per person aged 15 plus. For alcohol health harms, alcohol led to 6,202 deaths, around 38,000 years of productive life lost, and over 300,000 hospital admissions. With regards to the alcohol deficit, the economic cost of alcohol in Ontario was estimated to be about 7.1 billion. The net revenue from alcohol in Ontario in 2020-2021 totaled about 5.2 billion, resulting in a deficit of around 1.947 billion. So it's clear that the various costs of alcohol exceed revenues. The next slide presents the alcohol deficit in a little bit more detail. So using data from StatsCan and the Canadian Substance Use Costs and Harms, or the CSUH study, we see that every province and territory in Canada runs a deficit from alcohol. The last row on this table shows the loss per standard drink, which works out to be approximately 34 cents per drink sold in Ontario. And just to sum in short, alcohol sales do not pay their way. So the WHO recommended tightening alcohol regulations during the pandemic with cost-effective and easy-to-implement policies to reduce the alcohol attributable burden of disease during a time when much of the population was stressed and anxious. However, unfortunately, we observed kind of the exact opposite of this, which was a lot of relaxation. There were many policies in place to ease accessibility of alcohol. For example, the expansion of alcohol sales in grocery and convenience stores, as well as online, and as extended trading hours, alcohol home delivery by third parties, for example, Uber Eats, and alcohol takeout. In addition, we saw continued decline in government-run outlets, for example, in Ontario, BC, and Brunswick, with movement towards privatization. For example, in Saskatchewan, they fully privatized. Some more positive trends, though, include greater interest in minimum pricing policies and alcohol sales taxes in some jurisdictions, such as Newfoundland and Manitoba, and provincial territorial alcohol strategies and action plans being released and in development, for example, in Newfoundland, Northwest Territories, PEI, and Saskatchewan. So this slide kind of gives an overview of the CAPE methodological process. CAPE follows a rigorous methodological process, which involves developing and then applying the scoring rubric in order to produce CAPE scores. The rubric is a template that details the policy indicators for which we collect and score data. These indicators are considered the best practice and are grouped into policy domains. The domains are based on broad policy areas with well-established evidence showing positive impacts for public health. As the research team has evolved, so too have the policies included in CAPE. So there are now over 300 indicators evaluated as part of CAPE. Updated evidence, such as for labels and pricing, informed the CAPE 3.0 domains and indicators, which resulted in new domain rankings compared to CAPE 2.0. So it is important to note that the results are not directly comparable between CAPE 3 and CAPE 2, as the evidence and policy indicators are updated each time, but they reflect the overall direction of government approaches to alcohol policy and addressing alcohol harms in Canada. A comprehensive description of the project methodology and summary of the evidence for CAPE policy domains is also available on the CAPE website. Before we move into the results, here's just a quick look at the policy domains included in CAPE 3. There are 10 domains included in the federal assessment and 11 domains included in the PT assessment. The stars here indicate the domains that we will be presenting in detail today. Details of the 300 plus CAPE indicators can be found in the scoring rubrics. It should be noted that when presented in the various knowledge products from CAPE, the domains will be presented in rank order based on the weighting of effectiveness and scope, thus producing like the highest overall impact. For example, listed first here is pricing and taxation as the most heavily weighted domain in CAPE. And this is because policies such as minimum pricing, indexation, alcohol sales taxes, and retail markups are some of the most effective strategies that reach a large proportion of the population and have a significant impact on reducing consumption and alcohol-caused health and social harms. It's important to note that the policy domains assessed by the CAPE team form part of a comprehensive and synergistic approach to preventing and reducing different types of alcohol harms. And I'll now pass it over to Tim, who will be presenting in more detail about the scores as well as the pricing domain.
Thank you, Bella. Yes, I've got control of the slides now. Good morning, good afternoon. So here's a summary. When all of that work was done, all that the help collecting those 300 plus indicators, all the interviews, all comes down to reducing it to a single number, a single score. The average score, I think, for the whole of Canada was 37%, and Ontario came in at 40%. And these are low scores without much variation, but behind these scores is actually huge variety, and we're going to show you a little bit of that in relation to some of these particular domains. It's best looked at 40% of Ontario's potential to reduce harm from the use of alcohol by the people of Ontario. So let me just advance that. I should say at 40%, so Ontario is now in third place. In the previous iteration of this 5 years earlier, it was first. It was not very impressive. I think it was about 47% or something like that. Was 46% was the score. And there's been a bit of sliding backward on the policy side as Bella just described. So the good news, however, is that the 100% isn't an incredibly unrealistic standard that we're setting that nobody is achieving. In fact, if you took the best practices being done by jurisdictions across these 11 domains and added them all up, and the very best practice cover about 80% of the score, and there's just a few stretch targets in there, like whether there's a drinking age of 21, and nobody achieves that. But by and large, maximum scores are being obtained somewhere on nearly all of our indicators, and 80% would be a pretty decent. It would be an A- score in a school essay or project. So slightly more important task, saving lives. So next, summary of the scores, the average scores for Ontario in each of the domains. And there's more variation here across the domain, down from a low of 13% for health and safety messaging, up to 71% for monitoring and reporting. So Ontario is doing a really good job of counting the costs and harms. and less good on implementing some of the evidence-based policies that could reduce those harms. And 37% for pricing and taxation being the most heavily weighted and important domain. And and what could be done to improve that is very much within the control of the Ontario government. So let's look more closely at that, about where things fall down or where there's some bright spots. So a little background of pricing and taxation. It's really the holy grail of alcohol policy to maintain higher prices, whether it's through taxation or directly on pricing strategies, because the evidence is overwhelming that it not only reduces consumption, but there's evidence of direct impacts, reducing alcohol attributable deaths, hospitalizations, alcohol-related crime. One of the little wrinkles here is that you can set, for example, a nice high tax, but if it's not like a sales tax set at a proportion of the total price, in time, inflation eats into its value. So, there's some states in the US where they have excise tax of a penny a gallon that was set like 70, 80 years ago. So there have been some problems with excise taxes being eroded and having lost, they haven't kept up with inflation over the last 40 years. Of course, that's a federal government, but there's also issues with pricing markups and minimum prices not keeping up with inflation, which is an Ontario specific policy. So taxation, the levers that governments can pull on to affect these changes are established. They're there. It's just they are a little bit difficult. People don't like increases in taxes. And of course, it goes directly to the heart of industry's interests in maintaining profits. And they will fight to the last person to stop increases in taxes. So they are incredibly effective in relation to taxes, sometimes hard to achieve, but minimum pricing, the range of pricing policies here is increasingly recognized as very feasible, very effective, very targeted, and has a number of virtues which I'll describe. So, and yeah, alcohol sales taxes are implemented in all provinces and territories. So, what we know in terms of the effects of minimum unit pricing, Canada actually is one of the leading countries that have got the longest track record, and Ontario in particular, of having minimum prices. Now, I'm not saying minimum unit pricing. Minimum unit pricing applies to means that you define a unit of ethanol as pure alcohol by the litre or standard drink or unit, whatever, and you set a floor price by which you cannot sell a unit of that ethanol. In Canada, we've set it per litre of beverage by and large. There's been a few shifts towards it being per litre of ethanol in some places, but by and large, since prohibition was repealed in Ontario in the 1920s, minimum pricing was put in place by the liquor monopolies to protect their market and stop the import of cheap beer, for example, or spirits from south of the border or from anywhere. So it's not for public health, but for maintaining steady revenue for government. We advised Scotland when it was looking at this policy to apply it per unit of ethanol, which they've done. And famously, minimum unit pricing was introduced in, I think it was 2018, May 2018. And there's been amazing impacts, 13% reduction in deaths, especially deaths related to people with severe alcohol dependence, so 23%, and liver cirrhosis. So higher reductions in deaths from liver cirrhosis and related to severe alcohol dependence. And of particular interest, it's been the low-income regions of Scotland where these impacts have been largest. So there's often the fear that this won't impact people with alcoholism, severe alcohol dependence, or people on low incomes. But the opposite has been true. The largest benefits appear to have been accrued in those regions and by those people. So, and also qualitative research has tried to find evidence that there'd be unintended consequences, but without really finding much evidence in vulnerable populations, and also evidence for some benefits. A lot of research published on that. So in comparison with the other states and territories of Canada, again, we're kind of bang in the middle. 37% score on this dimension. The territories notes are really low because they don't have minimum prices at all. It's only the provinces thus far that have them. Prince Edward Islands gets the highest, the only jurisdiction with a pass score of 51% because it has a really high alcohol sales tax. And now let's look at a little drill down. If you could pay attention to this chart showing minimum price rates, these are average minimum price rates per standard drink, Canadian standard drink. The black is what's recommended. You can see there's off-premise and on-premise, and the red is what's actually happening. So you can see for off-premise, they're way below. Less so for spirits and wine, especially for beer and coolers, way below what's recommended. For on-premise, they're almost half the actual recommended minimum prices for alcohol sold in bars and restaurants is completely irrelevant. I think they'd be very rare. You know, there might be some extreme discounts and special offers. So the actual recommended is almost the same as what we're recommending for the off-premise. It's so out of touch. They are, though, tied precisely to ethanol content for high-strength beers, not other products. They are automatically indexed to inflation for the off-premise minimum prices, which is good, with the exception of beer. And then there's a few dodgy things that happen, like delisting products. So in the LCBO stores, if they can't get rid of a particular brand or product, they mark it down. There's special delisted places in the stores where you can get cheap products, which is really bad practice. Also, if you decide to buy an awful lot of any one particular beverage, you get nice volume discounts. So these are unfortunate ways of undermining the value of the minimum prices. So again, in on-premise, they're lower than recommended, not tied to ethanol content, and they're not tied to inflation, and they haven't been adjusted, I think, in over 10 years. In general, alcohol prices have not kept up with the price of goods generally, with the exception of beer and spirits sold in bars and restaurants. There's not a special tax for alcohol. The same sales taxes are people pay in Ontario for alcohol as they do for orange juice and milk and bread and other goods. So some key recommendations to move things forward should say, if you look at the little note at the bottom, if Ontario applied the best existing pricing and tax policies across Canada, they'd score 88% on this or get an A. So this is all within reach, except that we know politically in Ontario, there's a government that's dead set perhaps on doing the opposite. So if minimum prices was for alcohol based on calculated on ethanol content and minimum unit pricing for all beverages, that would be a real advance. If they were set at, we've upped these levels to sort of $2023, so it's just over $2 per standard drink for off-premise, just over $4 for bars and restaurants. Those minimum prices and markups, etc., would all need to be indexed to the cost of living so they don't erode over time. And there should be a special additional tax on alcohol, recognize these externalities and the alcohol deficit that Bella mentioned. And with that, I will finish and hand over to Mark. Thank you.
All right, great. So good afternoon, everyone. Very happy to speak to you. I'm going to talk about physical availability and minimum age, legal age. And it's nice to be able to speak to my home province, even though I'm here in Nova Scotia. I'm from Toronto originally, and actually had the pleasure of working with both Toronto and the Hamilton Wentworth Public Health Departments about 30 years ago on tobacco control. So nice to speak to you. So I'm going to start just giving you a little bit of an overview of what we mean by physical availability. So really, physical availability is about the density of off-premise and on-premise. So off-premise being, liquor stores where you can take away, or restaurants and bars and clubs being on-premise. And basically, the density is a reflection of how many outlets are available per capita or relative to the size of the population. And obviously, with fewer outlets is obviously better for a population. The other aspect of it is trading hours. So how early in the morning and late in the evening are stores open to sell or outlets open to sell, and also what days of the week. There are certain days or limitations. And the third major piece is where outlets and establishments can be located, and whether there are sort of sensitive areas where these are avoided, maybe closer to schools or other places. So we're also speaking here about limiting the physical availability of alcohol by reducing outlet density and trading hours. And so there's a very robust literature that shows obviously that these are inversely related, that harms are increased with or harms are reduced, I guess, with lower outlet density than with higher outlet density, and that affects consumption and the amount of consumption and harm that's produced. And we're also speaking about takeout and home delivery, which has been a major increase, particularly in the era of COVID, with takeout and home delivery, and the spatial and temporal availability of alcohol, and its impact particularly to minors, because it's a more unregulated piece of the alcohol delivery system, and how that might lead to increases in consumption and harm. You may also think about, well, what about that question of, where alcohol is sold? And in Ontario in particular, there's been the dramatic increase in the availability of alcohol through grocery stores, moving away from a sort of a province-only model of LCBO stores. And so that's really not captured here in the physical availability. That's captured in a different measure called control systems. But here we're really talking about just sort of the metrics of how available per capita and how often these outlets are open rather than the types of outlets per se. So here is your domain scores by province and territory along the physical availability domain. So you can see that the average score for physical availability across Canada is about 40%. Ontario scores slightly higher than this at 43%. The scores are fairly similar, with outlier being Nunavut, which scored a little higher in the domain because it had the lowest on and off premise outlet density in Canada, and Saskatchewan scored a bit higher as well because they have legislated off-premise density limits that actually consider population size specifically. Either way, lots of work to be done around physical availability across Canada. So looking at some details about physical availability policies in Ontario specifically, blue refers to here as the off-premises. So off-premise outlet density includes private as well as government-run and ferment on-premise outlets. So that's brew your own. The limit was defined as 2 outlets or fewer per 10,000 population age 15 and older. The level of population-based off-premise outlet density is near the recommended limits in Ontario. Ontario has legislative powers to set limits for off-premise outlet density and sets a cap on grocery store licenses. Hours of sale extend longer than are recommended, the ideal being not before 11 a.m. and nor extending beyond 8 p.m. and fewer than 7 days of sale per week, and open less than the maximum possible hours of operation per week. There are voluntary restrictions on outlet placement in which the LCBO outlets typically adhere to. In terms of the orange, we're talking about on-premise. So on-premise outlet density includes licensed establishments such as bars and restaurants. And the level of population-based on-premise outlet density meets limits here, which is around 15 licensed establishments or fewer per 10,000 per capita, age 15 and older. Density limits, though, do not apply to all premises, and hours of sale extend longer than recommended, which is in here for on-premise consumption is beyond 1 a.m. The following day. And the third piece is the takeout and home delivery. And Ontario permits alcohol home delivery, including by a third party like Uber Eats. And takeout of alcohol from on-premise establishment is also permitted, though it is linked to food purchase, but is allowed. So this is the concern with the take-home and delivery piece. Now, looking at some key recommendations, first here would be to reduce existing density of off-premise outlets and strengthen density limits for off-premise outlets, as well as introducing density limits for on-premise establishments. Second would be to introduce placement limits for all premises, so just where and how many. It would be also beneficial to reduce and legislate maximum trading hours allowed per week. So restrict alcohol sales before 11 a.m. and after 8 p.m. for off-premise, and no later than 1 a.m. for on-premise establishments. And finally, it would be beneficial to prohibit on-premise alcohol takeout and prohibit alcohol home delivery, including by a third party. The evidence here early is showing that there's a leniency to checking for age limits, for instance, for home delivery and confirming, just dropping off the product at the door and driving away. So if Ontario implemented all the best existing physical availability policies across provinces, Canada's provinces and territories, they could achieve a score of 82%, which again is a substantial increase from the current score. So it's all within our province's power to enable these policies to enable effective policies. It's just having a willpower to carry that out. I'm just going to next talk briefly about minimum legal age. It's a little bit more of a straightforward domain, but minimum legal age laws offer health and safety benefits at the population level as they act to delay the onset of problem alcohol use or alcohol use in general and produce positive impacts across the life course. Minimum legal age laws make it more difficult for young people to access alcohol and communicate a message about community norms, beliefs, behaviors around alcohol, which help to shape consumption patterns and reduce underage drinking. Minimum legal age drinking laws effectiveness can be strengthened with proof of age laws that require anyone purchasing alcohol to present government-issued identification. And so there's actually really interesting literature that looks at research literature that looks at minimum legal age laws, both in the United States and Canada at different ages. And there's a very robust, effects of minimum legal age laws in terms of the amount of consumption and the harms. We see a step increase in harm and consumption in youth, whether it's set at going from 17 to 18, 18 to 19, or 20 to 21, no matter what jurisdiction in North America you talk about. So they do have profound effects, and it's demonstrated robustly in the literature across a range of health outcomes, social outcomes, crime outcomes, that those minimum legal age laws matter. And I know people might suggest, well, we haven't changed the law in quite a while, but there are methods for testing this out. Even with the existing laws in different places, looking at sort of life course data. Okay, so domain scores by province and territory. The average score in this policy domain was 25% nationally, and Ontario scored 34%. No province or territory currently sets their minimum legal age for the sale, purchase, and possession of alcohol to the recommended level of 21 years. So we have BC, Saskatchewan, Ontario, Nova Scotia, Newfoundland, and the Northwest Territories as having the highest scores for minimum age, which is 19. And there are no exceptions to legislation that allow the supply of alcohol to minors in specific environments beyond private residences. And so other provinces with 18 obviously will get a lower score. No jurisdictions currently have mandatory proof of age policies requiring that government-issued photo identification be presented at all individuals, by all individuals purchasing alcohol across all premises. Ontario has legislation that requires staff to request proof of legal age in the form of government-issued photo identification for persons who appear to be under the age of 19. And you see in some other places, we check under the age of 25 or we check under the age of 30. So those are there. Whether they're enforced or not is less clear. And as my son, who recently turned 19 and just went to the Nova Scotia Liquor Corporation store for the very first time and was not checked for his ID. I was a bit surprised. So it happens across the country. So last, I'll just talk about some key recommendations for minimum legal age. So a main recommendation would be to increase minimum legal age to 21 for possession and purchase of alcohol, and consider granting maybe a graduated access. So restrictions that might be tied to the alcohol strength. So you sort of phase into drinking harder or higher strength or higher alcohol content beverages. You may start off with lesser beverages and graduate, like we do with driver's license, graduated driver licensing, this has been a concept that's been explored in other places. Other recommendation is require proof of age identification for anyone purchasing alcohol, and perhaps a two-stage verification. So if you order online, for instance, you have to show identification to purchase online, and then you have to show identification when you pick it up or when it's delivered, or so on and so forth. So an example of a proof of age requirement that most jurisdictions have is the Check 25 or the Check 30 program, which is in place. But again, these are inconsistently applied, which limits its effectiveness. Although not legislated, these programs require staff to check identification for individuals purchasing alcohol who appear to be minors or under a certain age. However, it's very discretionary. And because no jurisdictions met the recommended minimum legal age of 21, there is substantial room for improvement in this domain across the country. And even if Ontario implemented all the best existing policies across Canada, the score would still only increase to 34%. So there wouldn't be much change. That's largely because of our national not following that recommendation of 21. So I'm going to end there, and I'll turn it back to Bella to carry us on.
Thanks, Mark. So now I'll talk briefly about some screening and treatment interventions, formerly known as SBIR. Some of the key things that we're looking at here is evidence-based, government-endorsed information and guidance on alcohol, which can provide an important framework for a range of prevention, education, and health promotion initiatives in both clinical and non-clinical settings. Screening, brief intervention, and referral in healthcare settings, and use of online self-guided SBIR resources as well, which are in fact effective in reducing alcohol consumption, particularly among those with early stage or less severe alcohol dependence. Inpatient and outpatient treatment services, including withdrawal management and harm reduction interventions like managed alcohol programs, which have demonstrated effectiveness in reducing the harms associated with alcohol use. So here we see that the average score for screening and treatment interventions across Canada was around 67%, and that Ontario scored a little under at 62%. Alberta, Quebec, and Newfoundland, all at 91%, scored highest and significantly higher, as they have SBIR resources available through healthcare providers, as well as online self-guided resources. So here's some more detail about the screening and treatment interventions policies in Ontario specifically. So this first set of points here in blue represents the population level guidance, screening tools, and services. We looked at the level of Ontario's adoption of the most recent evidence-based national drinking guidance, meaning an official statement from government acknowledging their support of and commitment to using the guidance in their jurisdiction, and allowing funding to be allocated to these activities around the guidance and their promotion. At this point, we were looking at the 2011 drinking guidelines. So Ontario did have informal endorsement of alcohol guidance in place during the data collection period. And this again was the 2011 guidelines. We also looked at whether screening, brief intervention, and referral training is available for healthcare professionals and is provincially or territorially funded. So Ontario, unfortunately, has no province-wide SBIR training or healthcare professionals available. We looked at whether there are online SBIR resources developed and or hosted by the provincial government readily available for individuals to use. and that resources are hosted and developed independently from the alcohol industry. However, Ontario has no province-wide SBIR services by healthcare professionals available and no active government SBIR tools available online. Next here in orange represents the treatment and harm reduction services, which were present at the time of data collection in Ontario. So there was publicly funded alcohol withdrawal management or detox services, inpatient and outpatient services beyond the 12-step model, and publicly funded permanent managed alcohol programs. So that's a little bit of a positive twist in the screening and treatment domain. This slide shows some of the key recommendations for this particular domain. So that's to formally adopt the most recent evidence-based national alcohol guidance with an official statement of support, provide health professionals with screening, brief intervention, and referral training, ensure availability of in-person or online SBIR services with health professionals, and to develop and or host online self-guided SBIR resources. If Ontario implemented all the best existing screening and treatment intervention policies across Canada's provinces and territories, their score could increase to a 97% from their actual score of 62%, which is a pretty significant change. Here are some examples of what Ontario is doing well, considering all of the domains. For off-premise minimum pricing, the price is automatically indexed to inflation, except for beer, and high-strength beer is tied precisely to ethanol content. Outlet density is near the recommended limits for off-premise establishments and is meeting the limits for on-premise establishments. There's also a cap on grocery store licenses, as Mark mentioned earlier. In terms of health and safety messaging, Sandy's Law requires mandatory signage for FASD. There's also many other policies that meet or are close to recommendations for penalties for Liquor Control and License Act violations, as well as alcohol sale and service training programs, which are both within the liquor law enforcement domain, and some aspects of monitoring and reporting that Ontario is doing really well. To finish off, here are just a few examples of recommendations for Ontario for other policy domains. Also note that you can see page 3 of the results summary report for Ontario for more detailed recommendations for all 11 policy domains. And you can see the best practice policy leaders table, which is another document for which provinces and territories have these policies in place. So for control systems, some examples from across the country include Nunavut, where all the liquor stores are 100% government owned and run, Nova Scotia, which has a relatively high proportion of government-run off-premise outlets, and BC, which still has government-run stores and requires a government wholesaler in the supply chain. For health and safety messaging, best practice examples include the mandatory warning labels required in Yukon and Northwest Territories, BC's The Proof Alcohol and Cancer campaign, and Alberta's mandatory prominent on-site signage and the comprehensive ongoing health and safety campaign on alcohol and health run by Alberta's Health Department. For alcohol strategy, a best practice example is the Newfoundland Alcohol Action Plan, which is funded and endorsed by the government, has leaders, an implementation committee, a set timeline, and evaluation assessments built in. And finally, for monitoring and reporting, best practice examples include Alberta, Quebec, Nova Scotia, PEI, and the Yukon and Northwest Territories, which scored highest on knowledge translation activities, all around 67%, for having a formally identified government leadership publicly reporting on alcohol-related indicators and conducting knowledge translation activities within the past 2 years that provide information on alcohol and guidance of recommendations on how to effectively address alcohol issues in their jurisdiction from a public health perspective. So that's all we have for you folks today in terms of the presentation. We'll now move it over to the Q&A session. Thanks for listening.
Thank you, Bella, Tim, and Mark, for that very interesting presentation and for providing a clear roadmap of evidence-informed interventions that Ontario can consider moving forward. We will now move on to the Q&A segment of this event to address some of the questions from our audience. Please continue to enter your questions into the Q&A pod if you have not already had an opportunity to do so. I'm going to start off with a question that was put in the Q&A pod. Mark, it's for you. Someone is asking if you could please repeat the on-premise and off-premise best practice ratios or density limits, please.
Sorry, just give me a second here.
No problem. And while Mark's looking those up, I was also wondering if the presenters could think about, so the Ontario government has announced that they're going to expand alcohol sales to all corner stores, grocery stores, and big box stores across the province, and the remaining grocery stores. And I was asked once physical availability is, or once home delivery, now that home delivery is widely available, is this extended access to physical retail outlets less relevant because folks could, you know, simply have alcohol delivered right to their home. So maybe Mark, we'll first start off with you. If you could please report on the recommended limits for on and off premise outlets.
Sorry if I wasn't clear earlier. So it's 2 outlets or fewer per 10,000 population age 15 or older for off premise, and 15 license established or fewer per 10,000 population for on-premise outlets, which is so as I said, I grew up in Ontario, and I would go with my father to the liquor store in the 70s, and boy, oh boy, it was like it was a room with curtains and a simple metal table. It used to remind me of Consumers Distributed, if that resonates with anybody. You'd go in with, there would be a piece of paper, you'd jot down your alcohol code, and you'd give it to a worker who'd go behind the curtain and then hand you something in a paper bag, and you left. There were very few of them around. So I just reflecting on this now, it's really quite a transformation over my lifetime. Sorry, that's a little just anecdotal piece. And I think it's interesting, the question about how the online, sales and delivery. You know, I think it obviously does matter to some degree. I mean, there's going to be a certain segment, maybe a more disenfranchised segment of the population who don't have access to online means to deliver. So you might be having physical stores may disproportionately affect more disenfranchised populations economically, but you're also opening up regionally to sales to people who may not normally have had easier access, now because of delivery have easier access. So you've created a bit of a problem that way. There are, of course, often charges, though. You know, people will often drop the fees if you order a large enough amount as well. So, you know, if you order $40 or $50 as a single purchase, you don't have to pay any sort of delivery fee. So online ordering ends up being bigger orders, I would say, in many cases. I don't know if that's what you're getting at, but that's what was just some thoughts.
No, thanks, Mark. That's exactly what I was getting at. The next question is from the Q&A pod. Someone is wondering about the value in advocating for a revised federal act on all substances. So given how easily provincial policies can be undermined, and during your presentation, you were talking about the erosion of alcohol policies in Ontario, but really across the country. So would there be value in advocating for a stronger federal act? Please, Tim.
Yeah, I think there is a value from certain perspectives. So there's certain issues that aren't captured. Alcohol isn't recognized as a harmful product at a federal level. There's issues around restricting advertising that are sort of federal and marketing. There's issues about labeling, and the reason for having higher taxes or whatever. So there's a number of issues that could be bundled together. However, I share the Brendan Smith, I think you raise a very good point. It's an opportunity for people who want to completely dismantle the provincial control systems, such as they are. They're being gently eroded by 1,000 cuts. They are just gradually being dismantled. If you look back 20 years, the change, we've got alcohol in supermarkets, corner stores. You could almost say, well, it's in Ontario, it's pretty much the game's over. So that while there are strong advantages, if strong action could be taken federally, I think there's a risk of dismantling control systems in the provinces and territories, and that would be damaging.
Thank you, Tim. I actually have another question for you. So when you were talking about minimum unit pricing policies, you shared some evidence that the sort of fear of unintended consequences for lower SES groups have not played out in jurisdictions that have implemented minimum unit alcohol pricing. I was wondering, is there evidence about how minimum unit alcohol pricing policies affect overall alcohol sales and profits? And why I'm asking that question, for example, is there an angle to potentially get governments and the alcohol industry on board for a minimum unit alcohol pricing policy approach?
I'm really glad you mentioned that. And I meant to include that in the presentation, because one of the big, and there's so many selling points for minimum unit pricing, but one is actually, and it's reflected by the fact industry groups, manufacturers in Canada have lobbied over the years to increase minimum price rates. And if you talk to them privately, they will acknowledge that. It's obvious. It's like OPEC wants to raise the price of oil to maximize profits. There are farmers in India who are trying to sort of march on Delhi to get minimum prices for some agricultural products. Producers make more profits. And in the system, the control systems we have in Canada, the government will also make more profits because they can have higher markups. Basically, you get higher prices. The additional profit to be made in Canada gets shared between producers, retailers, and government. And so who lose out? Well, people who want to drink a lot. But the rest of us gain because of the harms to others that are prevented from other people's drinking. And most people are unaffected because they don't drink enough for it to really impact their budgets.
Thank you. Another question that I have is, sorry, I'm trying to keep track of the questions here, and Quebec has a similar overall policy score as Ontario currently, yet my understanding is Quebec has much wider alcohol availability. So I was just wondering if you knew perhaps why the overall policy scores between Quebec and Ontario are currently similar, despite the fact that Quebec has much broader alcohol availability. Are there other domains perhaps that Quebec has stronger policies?
Off the top of my head, I mean, one thing that this speaks to is that while the total scores are similar across jurisdictions, behind that similarity are great differences. So you can score good or bad on 11 areas. And Mark or Bella, you might be able to help me think of things that Quebec does better than Ontario. The minimum prices they have on beer are reasonably high or higher, I believe, than in Ontario. I suspect there's some of the policies with of course, the corner stores is the example, which Ontario is now going to catch up and get a lower score. Mark, do you know about any of the other domains, or Bella, on screening, brief intervention, that Quebec is doing better than Ontario?
In terms of physical availability, they're doing a bit worse, and in terms of minimal legal drinking age, they are doing worse. So in the two domains I focused on here, I don't know if there's some other policies around, what about tax to inflation different in Quebec? Is it more tightly?
They're also significantly better in SBIR.
Okay.
Yes.
Thank you. That was a bit of a tricky question, and we're almost out of time. But before I let you go, one question came in, and I do think it's particularly timely and relevant, and I just want to give you a chance to respond. So, with the imminent changes coming to the alcohol marketplace, so that massive expansion I was just talking about that was announced in Ontario in December, do you have any recommendations for Ontario to best support the municipalities in our province with municipal alcohol policies to support them in preventing alcohol-related harms due to this massive increase in availability that's coming down the pipeline?
That's a fascinating question, because municipalities do have the power to implement their own policies above and beyond. I mean, provincial policy is a minimum standard, but municipalities can go beyond provincial policies. And I know there are small examples here in Nova Scotia, like the town of Wolfville, which has its own independent alcohol policy legislation, which was tied to the university and making, alcohol public consumption was, certain rules and regulations that were far more stringent. So examples do exist in a small scale where municipalities can exceed independently, but I don't. Tim may have more, or Bella may have more informed comment than mine.
There's some examples from BC where municipalities have had higher minimum prices for alcohol than was required provincially. I know there's some reluctance from municipalities. They think they haven't got the legal right, but they do. And we've got some resources that have been created at CISA. And basically, if you look at pretty much every one of the CAPE policy domains, it's possible for municipalities to create some structures, regulations which achieve the same objectives in relation to hours of sale, outlet density, pricing policies, liquor law putting priority for sort of enforcing certain aspects of liquor law, service to underage, prevention of service to intoxicated people, and also, I believe, even putting extra resources into impaired driving enforcement. So there's lots of areas that municipalities can act on.
And tobacco policy historically has been a great place where municipalities have exceeded provincial legislation and enacted very proactively. We can learn a lot from the way that municipal tobacco policy was introduced.
Wonderful. Thank you. So we are at time. So as we wrap up today's rounds, I would like to give a huge thank you to Bella, Tim, and Mark for presenting. I would also like to thank everyone who joined us for today's webinar. You can expect to receive a brief and anonymous PHO round survey for today's session. Please try to complete this to help us improve our programming. A reminder to everyone that TOPIC, the Ontario Public Health Convention, will be held on March 26th and April 3rd of this year. Registration is open. Check out topic.ca for details. Lastly, to access past PHO presentations and to view confirmed and upcoming sessions, please visit the PHO website, head to Education and Events, and click on Presentations. Thank you so much for joining us today, and have a great week.